Just take a look at San Diego County in California, where 96.7% of people hospitalized there since March have involved people who aren't fully vaccinated. And as we've seen, misinformation has not helped the vaccination process. Well, now San Diego County is trying to do something about that. The county has declared COVID misinformation a public health crisis, with top priorities being identifying and labeling health misinformation and better understanding gaps in information. The resolution passed 3-2 after a contentious 15-hour-long supervisors meeting where, let's just say, people had a lot of opinions.
Last I checked, you aren't my healthcare provider. The Constitution, the right to privacy guarantee us this. That's why this is America and you guys can't make your camps for the unvaccinated. What's next, Nathan? You gonna make me cut my dreads?
Guilty of misinforming the public. Most of all, trials will be held. You will be held accountable for your crimes against humanity.
The government is trying to coerce us to take this COVID-19 vaccine, but it's my body, my choice.
We have done that, and so now it's time, with public comment being closed, for the board to discuss this item. Ma'am, we're trying to get this meeting done, and we have been doing this through the whole day, and we've given everyone the opportunity to speak, and now the board needs the opportunity to be able to deliberate and vote on this item.
Talk about contentious. That was Nathan Fletcher, the San Diego County supervisor who authored the resolution. And Nathan Fletcher joins me now. He is the chair of the Board of Supervisors for San Diego County. Nathan, thanks for being here.
Thank you, Sir Michael. I really appreciate you having me on.
Absolutely. So how are you feeling now that this resolution has passed?
Well, I think we took a powerful step. We're the first jurisdiction in America to officially declare misinformation a public health crisis, and take definitive steps really based on the Surgeon General's report and guidance and advice out of Johns Hopkins and others that have studied this. And the reality is, for so long, the anti-vax, anti-science movement was relegated to the fringes of our society. But it has grown. It's become foundational to today's Republican Party. It has taken root and taken hold. I think it's a natural evolution of the carnage of what Donald Trump brought our country with alternate facts and saying things that are not true. And the implications are people are dying and hospitals are being filled up when we have it within our power to defeat this pandemic. But we will not defeat COVID-19 if we don't defeat misinformation.
And so, Nathan, as you think about misinformation and you think about just how angry, to be quite frank with you, some of the individuals there were, do you feel safe? Have you had threats against you and your family?
Well, we've endured, throughout the 18 months we've been confronting COVID as a public health agency, and really the face of this continued threats. But this is not an issue where you can be bullied and intimidated. This is not an issue where we can sit on the sidelines. I'm a combat veteran of the United States Marine Corps. You're never out of the fight, and we have to get in the fight, because I don't care what your ideology is. I don't care who you vote for. I care about you. I don't want you to die. And we have everything that we need, and this is a national problem. But it's going to take local government stepping up to find local solutions, working with trusted messengers. And it's not enough anymore to just promote the science. We have to aggressively counter the misinformation, because everyone knows the vaccine is available. Everyone knows it is free. What is stopping people from getting it is they are being led to believe things that are not true. And we heard it 15 hours yesterday. People coming down and saying more people have died from the vaccine than from COVID. That is objectively false. People coming down and saying, I'm a doctor and I've done my research. You're not a medical doctor, you're a chiropractor, and your research has been discredited a dozen times over. But we've got to lean into this fight, and we cannot be intimidated and we cannot be bullied, because there's too much on the line.
So what exactly does this resolution mean for San Diego County? You talk about it being too much on the line. Break it down for people who might be skeptical out there.
Well, the first thing is just having an honest debate about the issue. If somebody comes before our board and says, look, I get it. I read the 7 peer-reviewed scientific studies that a mask slows the transmission of the virus, which is why doctors have used them for more than 100 years in surgery. But this is America, and you can't make me cover my face, and the price of liberty means some people die. I think you have bad values and you're selfish, but that's not untrue. But that's not what people say. They come down and they say, I did my own research, and the mask makes it worse. And whether we're talking about vaccines, or whether we're talking about the dozen people who came before our board who made the case for why you should take a forced deworming pill, or whether we're talking about what gets spread about vaccines, We have to engage, and so our action is not just symbolic. We are actually going to be investing funds to provide information, to identify misinformation, to call it out, to provide people with the facts, and then really take an approach where we saw great success in our vaccine administration. Look, San Diego County, more than 85% of our eligible folks have been vaccinated. We're doing very well, but we did that by going boots on the ground, trusted messengers in communities, telling people why it's good. Now we've got to take that same approach and go back and tell people, this is what you may be hearing. This is why it's not true. This is where you get the evidence and the information. The other thing is that so many of the folks that are promoting disinformation have figured out how to exploit social media. A Surgeon General study pointed out that untrue stories are 70% more likely to be shared. We have to engage in that same fight. And we've got to do it digitally. We've got to do it on the streets. We've got to do it with trusted messengers. But we have to do it more intentionally than we've been doing it in the past. And really fighting misinformation is not just about COVID. This is a broader effort about everything from the integrity of our elections to what it means to live in this country. And we can have ideological differences, we can have values differences, but it's time that we start doing it in a more fact-based approach.
Right, and so that's interesting because California, Nathan, as you know very well, living there, I spent some time there a few years ago, is a very, very diverse state. And there are some communities of color who may not necessarily be consuming misinformation, but are still hesitant about getting the vaccine. I mean, African Americans, for example, are saying because of historic precedent, I just don't trust this thing. What do you say to those people, and how do you even reach them? Because those concerns are very legitimate.
Well, those concerns are exceedingly legitimate, and I'll tell you in particular what we did in the African American community. Look, we have a history in our country. We injected people with syphilis and did not tell them. There is a valid and legitimate reason for the African American community to question what's happened. So at the outset of this, we partnered with leaders in the African American community. We partnered with religious leaders, with faith leaders. We had African American doctors and experts and community leaders. We held town halls, we held forums, we walked people through and said, hey, that happened, and that was unequivocally, unquestionably wrong. It is new, and here is the new information. And we saw tremendous success. And we saw really high rates. The south part of our county, which is the most diverse part of our county, both African American and Latinos, has some of the highest vaccination rates. We hired in the Latino community from the tourists, community health workers to walk door to door and let people know, here's the information in a culturally competent way, in the appropriate language, in the right way. For our immigrant community, we partnered with our consulate, we partnered with Catholic Church sanctuaries, safe haven locations they can go. So whether it was the African American community, Latino community, others that are hesitant, we were very intentional. Now we have to go back and try that same approach in order to have it. But I'm going to tell you that 95% of the folks, 99% of the folks that came down to our meeting were not from those communities, and they don't have that same history. They're buying into something that's become ideological, and all we're asking folks to do is listen to your doctor who's probably a Republican. I mean, if your kid gets sick, you go to your pediatrician, you listen to them, and I don't know how listening to your family physician has become partisan. And the highest unvaccinated rates in our county are not in our African American community, they're not in our Latino community. They are in our more ideological, right, Republican type communities. And God, it breaks my heart when you talk to these doctors and they tell you the stories of people on the ICU table waiting for a ventilator who's saying, begging for the vaccine. It was someone on Facebook told me and I didn't know. And I want to make sure everyone has access to reliable, medically based information from a trusted messenger.
Well, look, Nathan, I think that's absolutely important, and maybe you should give the Lieutenant Governor of Texas a call as it pertains to some of those African American numbers. Thank you so much for your service to our country.